It's been one of the worst flu seasons on record. Many of those hit hardest have been healthy people who've fallen sick very quickly, and that's left our hospitals struggling to cope.
Josh Neuendorf was a fit 28-year-old with 3 young children.
I was going to the gym 3 days a week, working 50, 60 hours a week with the kids at home.
Pretty active, pretty healthy.
A couple of months ago, he came home with what felt like a heavy cold.
I just thought it was a regular flu, and I kind of just powered through it at home, went to work, and I wasn't feeling good. And then,
Just escalated from there, really.
yeah.
But Josh went downhill quickly and was admitted to the local hospital with a secondary bacterial infection.
They had to put him in an induced coma and operate on his neck, and then that's when they realised how bad it was, and it had gone down into his chest and his lungs and started attacking his heart and all of his organs and stuff, so airlifted straight to Royal Brisbane Hospital.
His body had gone into toxic shock syndrome. All of his major organs were shutting down and he was close to death.
They initially had him on basically every antibiotic they had available to them in the Brisbane Hospital. At one stage, they pulled me aside and they said, look, we might have to look into heart transplant.
Josh nearly lost his battle several times. But after 11 days in a coma and 4 weeks in hospital, he's now home and facing a lengthy recovery.
It's been tough, but
We'll get there.
yeah, one day at a time.
And it's cases like Josh that stretched our hospitals to their limits. Lou Irving has worked with flu patients for the past 30 years, but he's never seen anything like this flu season.
The bacterial infections are worse than usual. We're seeing the bacteria in the blood as well as in the lungs. We're seeing young people severely affected. Unfortunately, we've seen people die from secondary bacterial infection.
So far this year, there's been around 200,000 cases of flu confirmed by lab tests, more than twice the number from last year. But measuring how many people actually have the flu is notoriously difficult.
It's really caught us unaware. I think we found ourselves in the middle of a significant outbreak of flu, and we were right in the middle of it before we really knew what was happening, but that was happening everywhere.
For an emergency department, managing a flu epidemic presents specific challenges.
For a start, it's a contagious disease, and so from the moment we recognise that they're unwell, we really need to protect ourselves and protect the community.
Ward rounds are longer because you go from room to room, putting on a mask, putting on a gown, putting on gloves, walking in, coming out, taking all that stuff off. And of course, you know, no one begrudges that, but it needs to be done.
Trying to predict which patients are going to get a flu that's going to just keep them home and which patients are going to need to come to hospital or even to intensive care is a little bit harder in the very early stages.
And the sheer number of cases has put pressure on how many beds are available.
The very sick flu patients have tended to need to stay in hospital for several weeks.
Heading towards the tail end of the flu season, Lou and his colleagues are trying to work out why it's been so bad.
We don't have all the answers, but we know that there have been 3 separate viruses circulating. We know that the vaccine probably hasn't been fully effective for at least one of those viruses. People will be looking at the availability of better vaccines, and there are some vaccines overseas that we don't have access to at the moment, and that will be reviewed. The concept of universal vaccination of children, I think, will be back on the table for discussion.
While the hospital system has been stretched this year, the frontline staff have been proud of how it's coped.
It's important at the end of the day to check yourself and make sure that you're not getting compassion fatigue and making sure that, you know, the last elderly patient you saw with flu has got the same amount of care that you might have given to the first patient you saw at the beginning of the day.
My family and I just got vaccinated against the flu 2 weeks ago. When we were in Japan recently, we were watching everyone, particularly on the subways, wearing the masks, and I thought I'd be all for that because the whole point about them wearing masks is that you're not infecting other people.
Yeah.
Like, would you feel comfortable doing
I
that?
reckon it's a great idea. Because I think a lot of people assume that when they see people wearing masks, it's because they don't want to get sick.
Yeah.
But it's actually the
Other way
opposite.
around.
And on a plane, if you're sick on a plane, please wear a mask.
Yeah.
Every time you get on one in winter, you're going to get sick.
The only thing I would say is if we're going to wear masks, I think we need rules about what pictures you can have on it.
Yeah.
Because I reckon you could freak people out.
Yeah.
Why not just have a picture of a mouth?
Yeah, sure.
Wow, on that note, more still to come. Don't go away.